Hello everyone, my name is Andrea. This is our hair, skin, nails, and HEENT assessment. I will start by scanning the room and showing my camera with the mirror. So here's my computer and my camera. I have a detachable webcam, so I'm going to scan the room. Okay, so here is floor to ceiling of the room. Here's our patient. This is the wall. There's no notes. This is just, information for patients because we're at my job. And then a quick scan of the other side of the room. The door is closed. I have provided privacy for my patient and I. This is my table of supplies. So my Rosenbaum, my Ishihara. Again, there's no notes on anything. Here's a pocket Snellen test. Hand sanitizer and all the other supplies and somehow a rubber ducky for our assessment. I'm going to reattach the camera and start the assessment. So again, privacy has been provided for. The door is closed. I'm going to wash my hands and start. How are you today? My name is Andrea. I'm a nurse practitioner student. I'll be taking care of you today. Is that okay?
Yeah.
Yeah? I'm going to review your vitals with you and then we'll get into why you're here today, okay? So your temperature was 98.6. Your heart rate was 85. Your oxygen saturation was 99. Your respiration rate was 20. Your height is 5'1". Your weight is 140 pounds, and you have a BMI of 26.4. Additionally, your blood pressure was 120/68. Okay. All right. So, what brings you in today?
My right ear hurts.
Your right ear hurts, and for how long has that right ear been hurting?
A week.
A week. And did that pain start suddenly, or did it slowly come on, like it was itchy or it felt full and then it started to hurt?
Yeah, it was itchy.
It was itchy. And have you had this pain before?
No.
No? Do you have any history of ear infections, even as a child?
Yeah.
Yeah, you had ear infections as a child, but not so much as an adult?
Mm-mm.
No? Okay, and what makes the pain feel better?
Ibuprofen.
Ibuprofen, you've been taking that a lot lately? Yeah. And is there anything that you do that makes it feel worse? No. Okay, and not like change of position, nothing like that when you lay down in bed at night?
No.
No. Okay, and do you have seasonal allergies?
Yeah.
Yes. And have you recently had an injury to the ear?
No.
No. And what about swimming or going on an airplane, anything like that?
No.
No. Do you have any other chronic health problems?
No.
Do you take any other medications on a daily basis besides the ibuprofen for the pain recently?
No.
No. And do you have any allergies to any medications?
No.
No? Okay. So if you're ready, we can begin your assessment. All right. Thank you. Okay, so we're going to start by inspecting the skin. I can see that the skin is free of lesions. I don't see any ecchymosis. I don't see any rashes. I don't feel anything. The skin is smooth and warm. The hair distribution is normal and even on both sides. I don't see any jaundice, pallor, or cyanosis. When I look down at the hands, the nails are well maintained. The nails themselves are clear. I don't see any evidence of any thickening, discoloration, splinter hemorrhages. The nail angle is at about 160 degrees. Capillary refill is less than 1 second, and that is bilaterally. And I don't see anything in between the fingers. And then we're going to assess for skin turgor. So we're just going to pinch the top of the hand, and the skin goes right back, so we know that that's elastic. And then also too, we can check for skin turgor at the clavicle, which is actually better for older adults, but for her we can do either. And we're going to move our gaze to the top of the body, to the head or the hair. I can see that the hair is well maintained, that the hair is evenly distributed around among the head. I don't see any patches where there isn't hair, or any evidence of alopecia. The hair is strong, it doesn't come out when I pull on it. I look at the scalp is white. I cannot see any lesions or dandruff. I feel the scalp is firm. I don't feel any lumps. Does any of this hurt you?
No.
No? Okay, good. All right, and then let's move on to the face. So looking at the patient's eyes, I can see that the eyes are symmetrical, that the outer canthus of the eyes line up with the top of the ears. The eyebrows are have even hair distribution and are symmetrical as well. The eyelashes are everted. The upper and lower lids don't show any evidence of erythema or exudate. The sclera is white, and I'm just going to pull down, and the conjunctiva is pink, and again, I don't see any erythema or exudate. We're going to begin by assessing the patient's cranial nerve 2 by doing the Snellen test and the Ishihara color blindness test. So if you could just hold this at arm's length and read this line and then read that line.
9, 3, 7, 8, 2, 6, 4, 2, 6, 7, 3, 9.
Perfect. And our patient has 20/20 vision. We would also do this if they had glasses, with or without glasses, and then on both eyes separately as well. I'm going to do the Ishihara test for color blindness. Just tell me what numbers you see.
29, 8, 12, 5.
Okay. And we're going to do the cover on cover test. You're going to cover your right eye, look up at me, and then take it away. And I see that the eyes stay midline. There are no extra movements of the eyes. You can do that again on the other side. And again, there were no extra movements of the eyes. Both eyes stayed midline. We're going to do cardinal gaze, which assesses cranial nerve 3, 4, and 6. You're just going to follow my finger as I make a shape, okay? Just with your eyes. And the eyes moved smoothly, symmetrically for cardinal gaze. We're also going to look for convergence. So just look over at my finger and then just keep looking at my finger. Okay, and when I bring the finger in closer, I can see that the pupils converge and the pupils constrict. So we're going to assess for confrontation, which is, again, these are all cranial nerve number 3. Can you just cover one eye, and I'm going to hold fingers up, and you're going to tell me how many fingers you see.
3, 2, 3.
Good. Thank you. Okay, and then we're also going to assess for confrontation. So I'm going to put my finger about 10 centimeters away from the patient's face. Can you look off into the distance? And then look back at my fingers. And then I can see that the pupils constrict to accommodate for the closer gaze. So again, cranial nerve number 3 is intact. We're going to assess cranial nerve number 2, and this is going to be our direct and consensual response to light of the pupils. I can see right now that our pupil size is about a 4. They are equal, they are round, and when I shine the light into her eye, the pupil constricts to about a 2. And we can do that on the other side, and the same. It goes from a 4 to a 2. And then we're going to assess for a consensual response, so we're only going to shine the light in one, and but we're going to be looking at the opposite eye. Okay, so, and I can see that the other eye, the opposite eye, the pupil goes from a 4 from a 2, just the same as the eye that had the direct light in it. So again, cranial nerve number 2 is intact. We can say with these tests that our pupils are equal, round, reactive to light, and accommodate appropriately. Also going to do the Hirschberg test to assess for cranial nerve number 5. I'm going to shine the light in between the patient's eyes. I can see that the light reflection is midline in the pupils. There is no deviation in either eye. They are both symmetrical. Okay, we're going to move on to the nose. So I can see again that the nasolabial folds are equal. Until your head back. The nares are equal size. I don't see anything at this point that would indicate to me any sort of deviation of the septum. Can we, can you block one nare and then inhale? Okay, right nare is patent again, and both nares are patent. We're going to assess for cranial nerve number 1, which is the olfactory. Can you close your eyes? And can you tell me what you smell?
Cinnamon.
Cinnamon. So our patient has guessed that correctly, so cranial nerve number 1 is intact. Now we're going to do the internal inspection of the nose. So can you just tilt your head back a little bit? And looking in, I can see the cilia. I do note some erythema, no discharge, and the turbinates are slightly swollen, indicating most likely allergic rhinitis that the patient has already stated. Okay, we're going to move down to the mouth now. Again, the sides of the mouth are symmetrical. We're going to assess for cranial nerve number 7. Can you smile for me? Frown. Puff your cheeks. Raise your eyebrows. Close your eyes. Show your teeth again. And show your teeth. Perfect. Cranial nerve number 7 is intact. There was a symmetrical response on both sides of the face. We're also going to assess for cranial nerve number 5, both the motor and the sensory response. So just going to feel the masseter muscle. Can you clench your jaw? Okay, and I feel a symmetrical response on both sides. So I know that the motor aspect of cranial nerve number 5 is intact. So now we're going to do the sensory, which, can you just close your eyes for me? And just tell me where on your face you feel me touch you.
Forehead. Cheek. Chin.
Okay, and again, cranial nerve number 5, the sensory aspect is intact on our patient. Going to palpate the temporal region. Our patient has a 2+ pulse bilaterally. Does it hurt when I press on this?
No.
No? Okay. And I don't feel any indication of cording, and our patient is not reporting any pain when I palpate that area. Okay, we're going to move on to the assessment of the mouth. We'll continue the assessment of the mouth. I can see that the lips are pink, they are moist. I don't see any lesions, any cracks. I don't see any angular chelosis in the corners of the mouth. Can you open your mouth for me? Okay. I don't see any dental caries. I can see that we've had a filling or two. The buccal mucosa is pink and moist. I don't see any lesions. Alright, I'm going to put on gloves and continue my assessment. Okay. I'm going to assess for cranial nerve number 12. Can you stick your tongue out? And can you move it side to side? And close your mouth. Press on my hand with your tongue, like press in your cheek. There you go. Other side. Cranial nerve number 12 is intact. Can you open up again? Stick your tongue out. Let me get the light on. And I can see that, I can see can you lift up the tongue? The Wharton's ducts underneath the tongue. And can you stick your tongue out and say ah?
Ah.
And I have a symmetrical raise of the soft palate and uvula. The tonsils are just behind the pillars. So I would say that I would give them a grading of 1. I don't see any evidence of tonsil stones, exudate, there's no erythema of the posterior pharynx. And we could assess, this is assessing cranial nerve number 9 and 10. Also, we could assess for the gag reflex, but we are not going to unnecessarily gag our patient for this assignment. Alright, before moving on, I do want to elicit the red reflex and do a fundoscopic examination of the eye. Okay. So I'm just going to shine this light in your eye. Look over at me. And I can see the red reflex. And you would do this again on the other side. And then I'm going to take a deeper look into the patient's eyes to get a fundoscopic assessment. So when I look into the patient's eyes, I can clearly see the darker spot of the macula, and that's going to be on the nasal side, and then the optic disc, which is well demarcated, and it's along the temporal side. There is a 2 to 3 ratio between arteries and veins. The veins are bright red, the arteries are a little lighter. I also see no evidence of hemorrhages, cotton wool, or nicking. So again, this is a normal fundoscopic assessment of our patient's eye. Okay, going to assess the ears now. So looking at the external ear canals, they are symmetrical. The skin is again warm, pink, smooth, and dry. Looking in the ear canal, I don't see any exudate or cerumen. When I pull on the ear, does this hurt?
Mm-hmm.
How about when I press over here?
Mm-hmm.
No? And then on the other side, I don't see any evidence of exudate or cerumen. Does it hurt when I pull?
No.
No? And what about when I press over here?
No.
No, no pain. Okay, so our patient is reporting right ear pain, so I'm going to look at the left ear first. And before I put my otoscope in, just going to assess the ear canal. I can see that the ear canal is patent. I can see the cilia, and I can't see any exudate or drainage from the ear. I'm going to pull up and back so that I can observe the tympanic membrane. And the tympanic membrane has like a pearly color. I can see the arm of the malleus. I don't see any evidence of exudate, erythema. I don't see any fluid behind the eardrums. There's no perforations. And there's good conal light at 5 o'clock. So again, we're going to go on to the other side. And again, I can see that there is no erythema in the ear canal, so I'm going to advance the otoscope while pulling up and back. So this patient, I cannot visualize the tympanic membrane. There is a yellow-white exudate in the ear. The ear canal is swollen. It's bright red, indicating that this patient probably has like a suppurative otitis media. Okay, we're going to assess our patient's hearing by doing the whisper test, the Weber test, and the Rinne test. Okay. If you could just kind of look the other way, cover that ear.
The cat ate the food.
Okay, and I'm going to go on to the other side, cover the other one. Nope. Good.
The dog ate the food.
Okay, so our patient's hearing is intact. We're going to do the Weber test for lateralization. So I want you to tell me whether you hear the sound or feel the vibration on both sides, or if it's only on one side.
You hear it equally?
You hear it equally. Okay, so we know that the hearing, the lateralization, that's a normal finding on the lateralization test. And then we can do the Rinne test. Again, going to place our tuning fork on the mastoid. Can you just tell me when you stop hearing the sound?
Stopped hearing it.
Okay, and then you can hear it?
Yeah.
Yes. So we know that bone air conduction is longer than bone conduction. It's actually 2 times longer. And again, this is a normal finding for the Rinne test. Okay, we're going to move on to the neck and lymph node assessment. Alright, so I see that the neck veins are flat, the trachea appears midline, the skin again is warm, smooth, and dry. Okay, so palpate the trachea is midline, and then I'm just gonna do the lymph node assessment, starting with the occipital lymph nodes. Let me know if anything hurts. Okay, and then the postauricular, the preauricular, tonsillar, submandibular, submental. So we're going to do the anterior cervical, both superficial and a little deeper. Okay, and can you shrug your shoulders for me? And then we're going to assess the supraclavicular. And again, I don't feel any lumps or bumps, no evidence of lymphedema or lymphadenopathy. Alright, I'm also going to feel for the carotid pulse. And we have 2 plus pulse pressure bilaterally. It's equal. Going to listen for bruits. And you just exhale and hold it. Okay. Exhale and hold it. Okay. And I hear no evidence of bruits on auscultation. Okay, before moving away from the face, I want to just let me know if you feel any pain. Assess for sinus pain or pressure. No? What if I percuss? No? Okay, good. We're going to assess for jugular vein distension. I don't see anything as a patient sits up. The neck veins again are flat, and we'll put our patient at a 30-degree angle and measure jugular vein pressure. And you scoot back here. So again, I don't see any evidence of jugular vein distension, but I can see the pulsations. So just pull that a little bit. I'm going to measure from the angle of Louis where I see the pulsations. And that puts me at about 2 centimeters. So we're going to add 4 to that, giving us an approximate jugular vein pressure of 6, which is within normal limits. So you can sit up again. Okay, we're going to listen to our patient's heart sounds. We are going to listen in all 5 areas, aortic, pulmonic, Erb's point, tricuspid, and mitral valve. And locate our landmarks. We're in the second intercostal space. We're also in the second intercostal space, third intercostal space, fourth intercostal space, fifth intercostal space, midclavicular line. Okay, and I can clearly hear an S1 and an S2. I don't hear any clicks, gallops, murmurs, or extra heart sounds. You can also do this again with the bell of your stethoscope, but for the sake of this assignment, we're just going to do the one time. Also going to assess lung sounds, so if you could just turn for me. There we go. Okay, and now I'm going to inspect the skin again. Again, I don't see any lesions. I don't see any evidence of any patches in color. Again, the skin is smooth, it's warm, it's dry. And then I'm just going to watch my patient breathe for a second, and the chest widens and falls symmetrically at the same time. So now I'm going to assess for lung sounds. Okay, and then every time I move the stethoscope, could you please can you please breathe in and out? Okay, you can turn back around. Our lung sounds are clear. I don't hear any evidence of rales or rhonchi. These sounds are even on both sides. Before we conclude our test, I'm just going to assess for cranial nerve number 11. Can you just scoot forward? And the range of motion of the neck. Can you move your head back and forth, side to side? Give me a big circle. Okay, patient's range of motion is appropriate. There was no pain when you did that, right? Okay, can we shrug our shoulders? We're assessing cranial nerve number 11. Can you shrug your shoulders now with some resistance? Okay, and then push your face against my hand. Perfect. Push your face against my hand again. So cranial nerve number 11 is intact. It was a symmetrical response on both sides, with and without resistance. So I would like to thank you for watching my presentation, and have a wonderful night.